So my name is Keren Tang. I'm a city councillor 3 years into this term. I represent Southeast in Edmonton called Ward Gadahio. I am an immigrant to this country. I became a citizen in 2015 and I was born originally in China. So as a Chinese Canadian, I have a very strong connection with um, the community and in particular Chinatown here, both from a personal and professional perspective. Um, and it was actually because of some of the work that's been happening in Chinatown that I started to work with the city of Edmonton in administration many years ago. Um, back in I think 2018 or so, supervised consumption site. We had a number of them open. Three out of four were open in Chinatown. It created a lot of commotion, turmoil. It created lots of division within the community. This rift between, you know, established cultural community groups affiliated with Chinatown, but also with the business community, as well as the social agencies who've also been there for quite some time, serving some of the most vulnerable. And at the time, the city council, their role wasn't supervised consumption site is a healthcare service, and their role was simply providing a letter of recommendation. But the city took a lot of the blame for the location of some of these sites. And at the time, Mayor Iveson, mandated the direction for a community wellness plan, and the was called Recover. It was meant to address a lot of these divisions, and I became the project manager for Recover. And ultimately, Recover was really about understanding the dynamics in the inner city core. There were 5 neighborhoods: Macaulay, Central McDougall, Queen Mary Park, Boyle Street, and downtown. And my task was to work with my team and try to work with all kinds of different stakeholders to see how people navigated some of these really challenging conversations and what were some of the opportunities for working together to overcome them. Um, we recognize that our role isn't to get any healthcare service out of a particular neighborhood, but we did have a responsibility to tell some of the stories that maybe wasn't told through the mainstream media to help build understanding, empathy, and arriving at some collaborative solutions. So through that, I met lots of people, but Chinatown certainly is a very critical, I would say, stakeholders community. We've had at the time, I remember working with lots of different people. We've held forums with the businesses. I got to know some of the key leaders with the Chinese Benevolent Association, the BIA, and had lots of lengthy conversations, even if we didn't necessarily agree on what the common solution was. Um, and through that, we really focused around um, sharing some of those perspectives, but also, to me, very critically, also sought to highlight to some of the experiences of vulnerable community members whose stories often don't get told in any of the stakeholder engagements. We deploy a lot of different researchers who walked along with community members, really understood their motivations and fears and their challenges and what it is that they saw for themselves as a good life. And if through bring those perspectives forward was how we were able to, I guess, coalesce a lot of the stakeholders to say, if this is the perspective that we are seeing, we're hearing, what are some of those opportunities? So on that project, I spent about 2 years, pretty heavily involved. Um, but during that time, I was also the board member with the Assist Community Organization, which is also, right in the middle of some of these conversations. Um, so that's kind of how I really got involved. I also saw, the general Chinese community citywide was very quick to mobilize. And I guess, I was very impressed by some of those mobilization skills, participated in some of the rallies, but I also wish people saw or understood or heard uh, different experiences and stories that they might not have, easy access to. So that I felt an important role for me is to help broaden the perspectives around this very, very complex situation.
Right, and that's what I'm also like kind of aiming to do with this, right? Because I feel like a lot of the issues that you just kind of talked about with the consumption sides and with how different ethnic communities reacted to it, right? It's not very known or talked about in I guess like youth around my age. They're kind of because like at my school or like around people my age, there's this common misconception that oh Chinatown is dangerous because there's people everywhere that do drugs. There's like quote unquote druggies, homeless people, and I feel like that it's not fair for people to kind of make that assumption when they don't really know, I guess, like you said, like all the stories of everyone who's struggling and the vulnerable voices that we should be trying to amplify, right? So a question that I had was to build off of what you said earlier was like what would you like consider as vulnerable voices in this issue, and in which ways do you think we can best amplify that?
Yeah. So around that time, and typically when there is like a really challenging big issue, we tend to bring the familiar voices together, whether they're associations or business leaders. Even when it comes to agencies and social service sector, it's the leaders of those organizations who then kind of represent the voices of their community members. Very rarely do we actually go to the person on the street and say,
Yeah,
tell me your story, whether we perceive them to be vulnerable or not. And that kind of data, that kind of storytelling, I think is really lacking when it comes to policy making. And I think that if we want to have good policies that's going to affect people, we really need the input of those people directly in some of these processes. So whether that is someone who is sleeping in the ravine, who are living on the margins, who are couch surfing, who are wandering the streets at night because they're choosing not to go to a shelter for a variety of reasons, or it's someone who is actually housed and have had very precarious history with housing, but are housed nonetheless. Or it could be, a frontline, I don't know, like someone who drives a van at night and does direct outreach to folks. I think those are some of the voices we need to bring forward to the fold. And even I think when it comes to in Chinatown, for example, there's lots of small business owners, some of them whom don't really speak English, for example, but they've been there for a long time. And but even when we engage with the business community, it is often the BIA, it is often the sort of association, and I think we really need to be at the doors and of some of these establishments and talking to the owners directly, talking to employees, because I think sometimes it does surface very different perspectives.
So it's like, you think, if I'm interpreting this correctly, you would say we should talk to the people who are working directly in these services, such as like nurses, such as harm reduction workers, or
I'm actually talking about people who are experiencing the issues directly.
Oh.
Why will we change anything about our housing policy or addiction policy without talking to the people experiencing the housing crisis or experiencing the addiction? I think simply seeing it from a service provider like the nurses, like the outreach worker, is not enough. And that's where we tend to go to, and I just think that's not enough. And so in this project, we really try to encompass a range of perspectives and really centered it on those who are most affected.
So how were you able to like center it? Could you talk about like a little bit more on how you were able to center it more on the people that were affected?
So like I mentioned, we did a lot of research, ethnographic research, which is a particular method where you really put yourself in people's shoes. You walk with them wherever they need to go. If people are wandering the street at night, drinking in a bus shelter, and then you wander with them and you ask them what are some of the places of meaning to them in the city, and people, through some of these questions, people tell you all kinds of stories, and it actually makes you understand the humanity behind these issues a lot better. You don't get that from surveys, you don't get that from focus groups, you get that by living the life of those that you're trying to work with. And it's very rare that this kind of research project happens. In my experience with the city government, we've only done it a handful of times, and I think it's very hard when we have those stories and we see it just, we actually use it beyond kind of seeing them as stories and start to impact on policies or service in a very meaningful way. But I think having those and hearing from those perspectives is a key first step.
Would you say that like a lot of places there are places advocating, I guess, for consumption sites but also like against them? Do you think that's why do you think people tend to like criminalize instead of humanize these consumption sites?
Because that's our human nature for centuries. We don't like poor people, we don't like homeless people, and when we don't like something, we see them in a very negative light. We criminalize them, we marginalize them, because it's easier for us if the problem is outside. So we can hide them away and we don't see them, we don't think about them, then things are better. City right now is engaging in a very interesting bylaw called public place bylaw. And I've recently had a chance to speak to a lot of different people, particularly peer navigators who work with people who use drugs on the street. And the whole premise about this bylaw is about increasing safety. But the question is safety for who? For the average person like you and me, we might feel safe if we don't see anything that's out of the norm, right?
It's like out of sight, out of mind kind of type.
Well, if we see people just walking down the street, minding their own business, for us, that's very safe.
Yeah.
But I think, and when we see somebody who might be doing drugs openly,
Mm-hmm.
we might feel very uncomfortable, and that discomfort translates into, well, I don't feel safe. Even if you're not being attacked, you're not being assaulted, it's about perception of safety. At the same time, when you actually hear from those who, engage directly with folks who use drugs openly or those who have had that experience, they might tell you actually doing drugs openly, it provides a greater sense of safety because they're less likely to overdose. Because if we start to hide people, they might go into the back alley where drug activity still happens and they're more likely to die. And that sense of safety is something you and I won't really understand, but it is a sense of safety nonetheless. So I think fundamentally society has a lack of understanding of safety from different lenses, from different angles. We try to develop policy and using lots of different lenses from gender, from race, from age, whatever. But unless you're actually putting yourself in those shoes, unless you talk to a very diverse group of people, it's very hard to get that comprehensive understanding.
Okay. So, I feel like that's really true as well. You kind of need to talk to everyone, not only the policy makers, but also the people directly being affected by these policies.
I think that's probably
Exactly.
to me, that's probably the only people you should really be talking to.
Right, because it's like your policies should be helping these people, but a lot of the times it's more about the assumption of what would help.
Exactly.
Yeah, what would help people. And I feel like a lot of policies as well is based off of what would help the general public, not the people who are vulnerable, not the vulnerable community. Because I feel like the vulnerable community seems like, from what we can see, it is a smaller community than the general public. However, we don't see the people who are struggling from drug abuse like within their own homes. We just kind of categorize them all as like people on the streets.
That's right. And I think if you actually looked at it, a lot of these folks don't really see themselves as vulnerable. They see themselves as having, dreams. They see themselves as having a lot of skills. Mm-hmm. Maybe it takes a lot of different ways for them to come bring those skills back. But people won't defend themselves as, the same category that society might place on them. Yeah. And I think, and that's kind of what our project tried to do, is to try to relabel people not from the way society sees them, but from how they see themselves, which is very different, which means the solutions and pathways to recovery, to employment, to housing, actually is very different. The way they see it for themselves versus how we might think they should see it for themselves. That to me is oftentimes a discrepancy between the policies we make and the effectiveness they have in moving people to a better place.
Right. Also, one of the biggest problems that I had, and one of the biggest motivators I had for starting this project actually, was when I was interning at CBA, I my president, May Hung, she's a great person. She's so educated and she does so much for the community. She kind of started talking to me about the injection sites around Chinatown and about the types of struggles that the business owners and people have faced after these started to like arise, right? Because right now what we have is 3 injection sites within 1 kilometer or more
Well,
of.
that's no longer the case.
Yeah, like I feel.
There's no more injection sites.
So for could you enlighten me on, I guess, the main difference between injection sites and consumption sites and kind of like the history behind that and how that's why there isn't that anymore? I'm a little bit confused about that.
Yeah, so they're technically called supervised consumption services because number one, it's a healthcare service, and it's consumption because it's not exclusive to injection drug use. And I think for this, you should really talk to, perhaps some of the public health experts. I'm happy to share some name with you, but that's the medical term for this because it's a healthcare service. When people start to label it as injection sites, it puts a huge negative connotation to what it actually is, because there's a lot of, I think, misperception placed on them. Oh, this is government giving drugs to the drug users. It's none of that. It's actually nurses, it's outreach workers, it's housing workers. So in one small facility, when people go access one healthcare service, the idea is that they're connected with other services that might help them in other ways. So it's not just like you go in there, do drugs and go, but you're there to form all kinds of relationships. So I think terminology does matter, and when we keep using the terminology of injection sites, it perpetuates the discriminatory, lens to how these services are perceived and also how these users are perceived. We continue to criminalize them. We continue to say this is a really negative thing, that they've done it to themselves, versus recognizing this is a healthcare issue. This is a health issue that such condition is a result of lots of different kinds of historical, environmental factors that have led this person to this path. And to resolve the issue of addiction, it's not just one point of contact with healthcare. It's actually a point of contact with healthcare and social service and housing and employment and all the things that, if you think about for you and me, what will make us successful in life. And that's the difference. Actually there's a movement right now to say the consumption, because right now the movement in the drug landscape is more towards inhalation. Elsewhere in the world, there are supervised inhalation sites, so that to recognize the changing drug landscape. We don't really offer that here as much, or we haven't really quite caught up to that. But again, I would highly recommend you talk to a public health expert about this. So in 2017, 2018, Alberta Health Services did place 4 within very close distance, and part of it has to do with the need. Sure, people have always said, well, a lot of the drug users are doing their drugs at home in the suburbs, but if you look at where the concentration of overdose are, where 211 crisis diversion calls are at that time, and we had to look at this data for the work that we were doing, was concentrated in the downtown. And based on some of those data, that's where the location landed. And a lot of people right now, part of why the conversation is so divided is because people feel it's very ideologically driven. Either supervised consumption sites are very progressive, NDP, radical left solutions, but I will actually argue they're evidence-based, research-backed healthcare interventions that has had a long history in this world's war on drug, versus kind of the current focus around recovery, which tends to be more, conservative, more right-wing leaning type of methodology. And, I don't think it's one or the other, and no one ever says one is better than the other. The point is we need all of it. And so because of our current direction with the government, with a recovery focus, I think there has been an effort to vilify sort of, ideologically left interventions like supervised consumption site. and to shut them down. And that has been happening for the past couple of years across the province. And I am not sure if the result is better. I am still seeing lots of folks doing drugs. They're just doing it with maybe dirty syringes, maybe in the alley. They're out much more out in the open. And I question if that is better. I don't think so. And I think when you follow the evidence, when you follow the data, and give some of these interventions time, people expect them to solve a very complex, addiction issue where the drugs that we have on the market today is far more lethal, far more violent than they were pre-pandemic. And I think we've seen what's happening in the BC where policies like decriminalization of small amounts of drug possession have led the critics to say, see, it didn't work, it's gotten way worse, and we actually need to go the other way around. And that is what's happening. But I just don't know if we've kind of given it the runway it needs to have an effect.
So how do you think COVID, what effect do you think COVID had on this entire issue as a whole?
Yeah, I mean, like COVID, like putting a lot of like distancing restrictions. And by the way, I think we're getting into a lot of like, I would say healthcare
That's true.
conversations. I'm a city councillor. I focus on municipal services. I'm not an expert in drug and mental health addiction. I think that those are better conversations you should have with a public health expert or with provincial people who might be more familiar. But generally, COVID putting a lot of distancing restrictions, and when some of these existing facilities, supervised consumption sites, they're fairly small. If I think about the one, it used to be at Boyle Street, it's fairly small. It's a three stall kind of facility, and then you put up additional distancing, then you can only accommodate so many people in that space. So less people are getting the service, and I think there's lots of trends and observation around kind of closing of borders, for example. The flow of drug trafficking is changing, and I think it led to, again, you should talk to like law enforcement about this, but just it led to a lot of different patterns in how drugs are created, their makeup, where they're distributed, etc. That we're seeing sort of that surge. And you can see this in the way drug overdose continue to rise year over year, and Edmonton has the highest drug overdose deaths in the province. And the current policy, I am not seeing is turning that trend around.
Yeah, I think that I definitely should talk to more people in law as well, because that's a good way to go about that. A question, one of my, I guess, like, biggest questions is, like, why, okay, so how do I word this? A lot of people in Chinatown, like business owners and Chinese organizations, they don't want these consumption sites in, like, their areas, right? Why do you think that they wouldn't want that? And also, like, what implications do you think these consumption sites have on Chinese organizations, such as like Chinese businesses or like organizations in Chinatown that I guess are impacted by these consumption sites, because that's the area that they're in, right?
Yeah, they're in the area that they're in not because it's Chinatown or because it's full of Chinese businesses that they're easy to pick on or whatever, but that's because of the concentration of where the needs are. Because of the concentration of needs, that's why we're seeing lots of agencies being kind of in the vicinity, and everyone is kind of like being pushed to this part of the city. And actually, historically, Chinatown, the Chinese community, they first started over by Canada Place. They were displaced out of that part of downtown to where Chinatown is today. So we're talking about a whole lot of displaced people, all displaced together, and not necessarily, I think we're at a point where not necessarily getting along, or like we're more displaced, and we don't want to see certain behaviors here. But even though we all have a lot of shared struggle of displacement and marginalization, so I think that's number one. there has been study that has done in terms of like the impact of supervised consumption services around on the surrounding communities. I would say, depending on the research, they looked at different factors. One study could say we've seen less needle pickup, for example. Others could say it has resulted in increase in other types of social disorder. And I actually can't name, I can't remember any of the research off the top of my head, but I think it's actually worth digging into some of that. But at the end of the day, in our work, we often talk about safety by the numbers of crime, right? And even though those numbers could be down, people's perception of crime has remained very elevated. So I think it comes down to what does the numbers actually say, and how are people perceiving their surroundings, and that part is really hard to change. But you're asking about why, like, how does it have an impact on Chinese people directly?
I feel like
Oh, I guess the other thing I was going to say was, so I think Chinatown has always had this history of displacement as well, and over the years, I would say isn't prioritized for investment in the same way the rest of downtown has been, whether that's in infrastructure or programming or other kinds of investment. And so for some, it feels like, this is a community that's been historically ignored. And then you're putting more problems to us, like we're a bit of a dumping ground. And it feels like we're being further marginalized. And I think that's fair. I think that's how people feel, and I think they should have a right to feel that way. Often, like a lot of the folks in the very marginalized homeless population or those with mental health and addiction are also Indigenous people who have been marginalized on their land. Again, we're talking about, herd people together, and I think there's a compounding impact of marginalization, of underinvestment, of feeling ignored by leaders, by society, and this just keeps self-perpetuating some of those negative feelings.
So, you mentioned how, I guess, the city isn't putting as much resources towards Chinatown as like the rest of the infrastructure around Edmonton, right?
I don't think it's just the city. I would say society, the province, federal government, private sector. If you
Why
look
is
at
that, though?
Well, I think it has to. I mean, if you look at how much private real estate developments happens outside of Chinatown, look at how much is going on here. It's not for a lack of trying, but I think people will put money where they think there's the greatest opportunity. And when they see, I think it has to do with perception, it has to do with a bit of history, and then the further concentration of these issues makes them less and less desirable place to invest. I would actually say, this term with this council, we've invested probably sort of historical attention and effort and lots of conversations. I would say, yes, spurred on by some of the tragedies post-COVID, but there has been, I would say, unprecedented attention on Chinatown as a whole. But I don't think solution is easy, though. I think most people think the solution is to, get all the social agencies out, then the problem will be solved. I don't think it would just manifest like that. We've been having that conversation for years. We've been having those conversations about distributing the social services across the city because the needs are spreading across the city, and we're doing that. But it will not necessarily solve, I think, Chinatown's compounding issues overnight. And that's why we have programs like, Chinatown Vibrancy. We have some of the what's called community revitalization levy to spur some of those investment from the public sector, but also from the private sector. I think all those things will take time to manifest and to help this community build its potential back up.
Right. I feel like from my personal experience, when I used to, like before working at CBA, right, every single time I would go into Chinatown with my family, I would feel, I guess, unsafe because of what I saw around. Like, I would see all these businesses with, like, bars over their doors. Yeah. I would see lots of disrespectful graffiti all over the place. I would see broken needles, glass everywhere, and just in general, like vulnerable people sleeping on the streets. And I felt like that really, when I was younger, ruined my perception of Chinatown. And that kind of made me really scared to, I guess, like go and explore and do more in that area, right? Have you ever experienced, like, do you think that this is something that is commonly seen by other youth as well? And what do you think we can do to make it, I guess, feel and look safer for people, right? Because, like you said earlier, when people see, like, people doing drugs or using drugs on the streets outside, like in public, it makes them feel very unsafe because they can actively see that, right?
Mm-hmm.
Seeing the kind of like needles lying around, seeing the graffiti and the encampments is also gives people a feeling, I guess, unsafe and a little bit like they shouldn't be there, right? Like I would try to, even when I go to work now, I would try to run like from my car to the building because I guess I still feel a little bit unsafe.
Mm.
What do you think what do you think people can do to kind of minimize that feeling of being unsafe? Because I don't want to feel this way. I know Chinatown is a vibrant place, is a place where people have started businesses, have started organizations. It is
Yep.
a place where a lot of people feel supported. How can we make other people feel more safe in that area?
So in all your time with working in Chinatown, have you done any walk-alongs with outreach workers, for example?
I have not yet.
Okay. Or visited any of the places, like say Ambrose Place?
Sorry?
Ambrose Place, is a permanent supportive housing that's right across from Hall Block.
No, I have not yet.
Yeah.
I'm not sure how to like get in contact with people that can allow me to do that, right? Because obviously I can't just like walk in
You can, actually,
Oh, really?
and that's what I did. In 2016 I had my baby and I was off on mat leave. I went to a talk at the time with Carola Cunningham. She was the CEO of Ambrose Place and she talks about the permanent supportive housing. And afterwards I just told her, like, I learned so much from what she said, and she was like, well, come on down, we're happy to show you around. And I did. I brought my baby with me that day, and I just knocked and I was like, hey, I'm just here for a visit. And then they had one of the resident there show me around and introduce me to people. I felt incredibly safe. And these are also folks who are walking along the street, and employees often go into the Chinese restaurant, they're patrons. I've been to businesses where non-Chinese people come in because they work for some of the agencies. They know the businesses very well. You see the relationships forming, and I think that's something that's not highlighted enough.
Yeah.
My background prior to working for the city or being in this role is in the social service sector. I used to work for, a friendship center that served urban indigenous people in a different city. So I'm very familiar, I think, with the social service setting. I've been coming to Chinatown, the minute I moved to Edmonton to shop, to eat, because this was familiar to me, and never once have I ever felt unsafe. Maybe partly because of my own lived experience and my comfort, I guess, in public spaces where lots of different kinds of people are mixed together, and have that maybe it's because I have a bit of understanding for, some of the challenges that people are struggling with for the way that they are. So I think having that understanding is really important. I think some of the efforts right now by the younger generation of, let's say, Revita, for example, of the Veloc parties that they've been hosting. They're taking up public spaces. They're not kicking people out. They're not keeping people away, but they're actually creating an environment to say, we have the right to be here, to be vibrant as much as we can, but we also have a duty to all community members, not just those who we perceive to be normal, right? And this is our community and everyone is welcome, so how can we create a space so that everyone can feel safe and everyone can feel welcome? They develop protocols, they work with agencies to focus on de-escalation rather than calling in law enforcement. There's lots of different ways, I think, creating that environment. And I think the more things we do And the more people like yourself get involved with those kinds of effort, it actually creates better understanding. It lowers our, heightened anxiety when we're in environments when with strangers we don't know about, or we don't know. And I think that helps to kind of take off some of those pressures. Even after the pandemic, I do go back to Chinatown quite a bit, to visit, to eat, to do whatever. And I bring my daughter along. And now she's school age, she can understand more. And we drive by lots of tent cities. And she asked me, what are those things? And I said, those are tents. And people are living in them on the sidewalk. And I asked her, do you think it's okay for people to be living on the sidewalk in a tent? And she said, no. Where should they be living? They should have a home. I think young children can understand that.
Mm-hmm.
And I think we need to cultivate some of those understanding and empathy, and not shy away from those conversations about why do you think they're living on the sidewalk? Because they don't have a home. Why do you think they don't have a home? Right? Like, I think it's actually, even we can have those conversations even with kids. And I think that's healthy. That's, I think that builds character for them, builds understanding, and also for the parents, for the community as well. And the final thing I'll just say is, in my lifetime, I really enjoy walk-alongs. I do it, just as a volunteer, as like in my own past professions. I think it really builds like a real understanding of the issues that you may read about in the newspaper, but really be in it. And I've done a few in the inner city, and one of which was with the YEG ambassadors, and they're not outreach folks. They actually focus really on building relationships with businesses. They go around, they report on graffitis, they report on needles, they report on garbage. Part of the idea is that the more you report these things, you get folks to fix those things faster, then there's a less of those things for passerby to see and then feel unsafe about, right? But they also like one day I went with the team, and we're just kind of walking and observing, and then they're kind of noting things, and we walk through behind one of the agencies. It's like a fairly large tent city. It was still early in the morning, and people were coming out of their tents, and they were coming, like saying hello to each other. They were saying hello to us, treating us as one of the community members, even though we dressed differently. We were clearly not, one of the campers. I think we have to recognize there's humanity in all of these things, that there's community, and there's a reason why people congregate like that, because that's where they're finding community, and I think we should respect that somehow and recognize it. And when that happened, I didn't feel uncomfortable anymore. I was, but I wasn't anymore, because I recognized we were just human. So I think walk-alongs are great ideas. Talking to as many players as you can. Know that each person brings a one perspective, and that's okay, and they're absolutely valid. And I think that's important because they have their own lived experience. But talking to agencies, like, I don't know, like, saying hello to some of those places that you might otherwise not visit, is a great start. A few weeks ago, Homeward Trust did their homelessness count. We were gathered at Hall Block, right? And I went out with a few of the volunteers, and their job is just talk to people and do a bit of a survey with them. Doing stuff, volunteering for things like that gets you face-to-face time with those who are sleeping rough on the streets, can give you a whole different perspective about life in Chinatown.
Yeah, so I feel like now that I've heard what you said, I feel like it's very important that people aren't just learning the facts from like the news or learning the facts from their preconceived perceptions, but also trying to familiarize themselves with that community, right? Mm-hmm. And I really like how you mentioned how this issue is like a human issue. It's not just a social, a political issue. It's a human issue. Mm-hmm. There are people sleeping on the streets. There are people who their business is impacted by this. There are people who feel unsafe. There are people who are unsafe because of the predicament that they are in, right? Yeah. So it's just like making this more of a human issue by having these types of experiences, right? And I like what you talked about, hold on, let me think about, yeah, like people reporting these issues to, I guess, like get more attention on them. But it's like, I feel like something I realized was like in a lot of Chinese and Chinatown communities, there's this common trend where people, even if they're given the opportunity to participate, they don't want to participate. They shy away from politics, from social issues such as this. It's like they have this, the Chinese community, especially like the older generation, like my parents' generation, my grandparents' generation, they have this kind of fear of participating in politics, in discussions such as this. And I think that's also like an issue in Chinatown because a lot of the businesses are run by people, like my parents' generation, my grandparents' generation. So it's hard for them to, there are opportunities to get involved, but it's hard for them to feel like they want to get involved because of
I'm probably gonna have to go shortly here, but if you look at an initiative like Chinatown Dining Week, the team that puts that on, they're volunteers, they've been doing it for many years, and they will tell you how much effort they put into building relationships with businesses. Chinatown Dining Week isn't about safety, isn't about supervised consumption sites, it's about highlighting restaurant, food, and elevating. Don't you think people will want to participate? But believe it or not, people didn't at the beginning. Businesses didn't want to because they didn't know if this was like a scam or if it was like a real thing. And that team had to work on breaking down language barrier. They had to like get to know the business owners and make sure they understood the benefits. Like that took years of relationship building. But once it's there, people are flocking to them, right? And so I challenge that people don't want to participate if they're given those opportunities. I also, because I think they do if we create the right conditions for it, the right relationships, and that takes hard work. And I think for young people like yourself, I think wanting to contribute to this community is great, but don't stop after one summer. Don't stop after you finish school. It's a lifelong commitment to build relationships, to have these conversations, to break down barriers and stereotypes, and build bridges between unlikely partners and unlikely groups of people. When I just coming back to some of the projects that we've done back in 2018, 2019, when it comes to solution, I actually couldn't believe how many ideas people had. When you actually boil down what it is that they want to do, it actually just about creating relationships between a houseless person and a business owner, for example, or an agency partner and somebody else. That's actually at the heart of, to me, what could have the greatest potential for moving Chinatown forward. Is that we're open to those conversations, we're open to those relationships, and that's hard.